Welcome to Deny Delay Depose. Health over wealth. Wow, what a week, huh? It feels like the world is on fire, both literally and figuratively, with the news coming out of LA.
Yeah, it's intense. I mean, seeing those images, the fires, the evacuations, it's heartbreaking. And the timing right after everything it just adds to this feeling that everything's kind of coming apart at the seams.
I agree that it is a tragedy and that people are suffering, and that these fires are terrible. But to suggest that the timing is connected to a past incident seems a bit much. These things happen, sadly. We need to see it within the context of our climate, environment, and the way people have decided to live.
But is it really just things happening? I mean, look at the news. The fires are horrific, yes, but the underlying issues, they just feel so connected. You have a system that isn't prioritizing people, where everything is about profit, 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 profit. And that leads to a lack of preparedness, a lack of resources when things go wrong, and people getting left behind.
I see it a little differently. Yes, it's a tragedy, but I see it as more of a symptom of a system desperately trying to reinvent itself. Think about it. Technology is finally hitting healthcare in a way that it's going to revolutionize everything. The old guard, the ones who have built this profit-driven machine, they're scrambling to maintain control, and things are going to be chaotic for a bit. It's like a snake shedding its skin. It's painful, it's messy, but it's necessary for growth. And sometimes, people get hurt in the process.
I mean, let's be real. It's not like these fires are just a random occurrence. We've been talking about climate change for years, and look at the housing situation in LA. These are real issues that are causing these problems. And if anything, we have to admit that our society and economic framework has allowed us to develop a firefighting infrastructure that is better than most places, including those with socialized care.
See, I think that's where we differ. I don't think it's a necessary chaos. I think it's a manufactured chaos born out of a system that's designed to prioritize profit over people. The insurance companies, for instance, they're all about denying claims, protecting their bottom line. And when the system is so broken, it affects everything else. It affects how prepared the firefighters are. It affects whether people can afford to live in safer areas, or even afford the resources to evacuate. It affects whether people can afford to have the infrastructure they need to be safe.
Okay, but let's be realistic. The insurance companies are businesses. They have to make money. I mean, yes, there are issues with how they operate, and they definitely could be better. But they are not evil. They serve a purpose, and they do provide a necessary service for some people. The problem is that for most of their users, the cost is prohibitive, or the denials are so regular that it becomes like a bad game of chance where the house always wins. And that is where technology comes in to help re-engineer the playing field.
That's the problem, though. They are a business first, and in healthcare, that's a disaster. It's not a service, it's a fundamental human right. Look at the fires as an example. People lose everything, and then they're going to have to fight their insurance companies for coverage. It's a perfect microcosm of the problems we see all the time with the health system. It's the same mentality. Deny, defend, depose. It's ingrained in the entire system.
But don't you see? This is what I mean by the system reinventing itself. These AI systems, the big data analysis, they can potentially take a lot of the power away from these big corporations. They could streamline the claims process, make it more efficient, maybe even create a more equitable system for pricing. Right now, the system is based on historical data, and if you live in the wrong place, the algorithm will treat you like a high risk and your prices will be high. But AI could use more accurate data sets to determine risk and price accordingly.
I agree that this idea of data-driven pricing has some value, but it is a little naive to think that it will eliminate problems. Algorithmic bias exists, and these same algorithms can be designed to be just as profitable for big business, if not more so. We might not solve the underlying problems of profit motive, and we might actually exacerbate them. But it can be made better if we do it correctly.
See, that's where I'm worried. It's not just about efficiency, it's about justice. The problem isn't the manual labor that people do to deny claims, it is the fact they are denying them in the first place. If you use big data to optimize the denial process, it's just going to make the system even more efficient at shafting people. And what if the AI itself is biased? These are systems built by humans with biases. If you are using data which is built on top of an unjust system, then you will be perpetuating the injustice. It's a garbage in, garbage out type of scenario.
Yes, but garbage in can also be garbage out if you are dealing with a bad human. But with AI, you have the opportunity to analyze and correct for bias. It can be programmed to be fairer. And think about drug discovery. AI can sift through mountains of data to find new treatments and cures far faster than any human could. It's already starting to show promise. It will cut down costs by making the process more efficient. We need to look at the potential of these tools and make them work for us.
Well, here's the thing. AI can be a great tool, but it's just that, a tool. We have to acknowledge that the system we have now is a product of a capitalist society, and that we need to take into account research and development costs, as well as the staffing and the facility costs. It's not simple, and it's not going to be fixed by just adding technology. It's way more complex than that. And it is not necessarily that the system is broken. It is just that we have to see it for what it is. It is a complex and expensive system that is often difficult to scale.
It's complex because it's built on a foundation of profit, not people. And that creates all these artificial hurdles and inefficiencies. Look at the drug companies. They're not incentivized to cure diseases. They're incentivized to create long-term treatments, right? Because that's what makes them the most money. And the whole system is built on that principle, from insurance to pharmaceutical companies. AI will not correct that fundamental flaw. It will just be another tool to optimize that fundamental flaw.
But profit isn't inherently evil. It's the driver for innovation, and it's what allows us to develop these tools. It's what gives people incentives to create value. Without profit, where would the funding for medical research come from? It's naive to think that you can just switch to some utopian healthcare system and expect it to work. It requires investment. The whole thing is about incentives, and right now the system is not balanced in favor of patients. But technology can help with that.
Exactly. The financial realities are unavoidable. You need a system that incentivizes risk, development, and innovation. It also needs to be funded in order to meet costs. Otherwise, it is just going to collapse. And we need the best minds to work on these hard problems, and that is often rewarded by a market-based system. Now, that doesn't mean it's perfect or that it can't be improved, but to just say profit is evil is not a realistic assessment.
It's not about saying profit is evil, it's saying profit should not be the primary driver of healthcare. When profit becomes the main goal, then everything else suffers. Quality of care, accessibility, and even the innovation itself. It skews priorities. It creates a system where costs are inflated and people are denied care. We need a system that focuses on health and well-being, not shareholder value. And we've seen examples of that in other countries where the results are better for people as a whole. It is time to make people the first priority.
And I hear you on the ethical concerns, but I think we need to be strategic here. If we can leverage AI to make the current system more efficient and transparent, that could be a stepping stone to even bigger changes down the line. It's about playing the game while also trying to change the rules. I mean, if we can use AI to make it easier for people to access care, to get their claims approved quickly, to get access to new drugs and research, wouldn't that be a win?
I agree that is a good idea and a pragmatic approach. And I also think that there should be government intervention in cases of unethical practices. That is why it is important to have systems like regulatory agencies to ensure fairness and that prices are regulatory agencies to ensure fairness and that prices are regulated. There are ways to improve it while keeping within an existing framework. And I do think that while some people have valid concerns, many others would not want the level of government control that a fully public or socialized system requires. There's a happy middle ground, and that's where we should be focusing.
But what happens to the people who are still left out? The people who don't have access to the technology, the people who are disadvantaged by the data, the people who can't afford even the optimized systems. It's like we are building a faster train, but not adding more seats. It will be faster for those who can afford it and worse for everyone else. I'm thinking of the people who lost everything in these fires, how they are going to be treated by the insurance companies. They will be fighting this system while also having lost everything. They are the ones who get the short end of the stick. Where's the win for them?
That's where the "and" comes in. Yes, we need to make the current system more efficient, and we need to ensure that everyone has access. It's not an either-or proposition. It's about using AI and other technologies to build a more equitable system, not just to make the existing one work faster. For example, AI can help with resource allocation, identifying underserved areas and directing resources where they are needed most. It's not just about individual benefit, but also about social benefit.
And that is key. We can use technology to improve things, but it's not a magic bullet. We need policies that ensure everyone has access to basic care and that these new technologies are available equitably, not just for the privileged few. So even if we don't go for radical system change, we need to address the systemic issues and the financial barriers that prevent people from getting the care they need.
And that's the core issue, isn't it? It's not just about technology or incremental change. It's about a fundamental shift in priorities. It's about recognizing that healthcare is a human right, not a commodity. It's about building a system that serves all people, not just those who are profitable. And right now, the system isn't even working for many of the people who should be profitable for the system. But there needs to be a system that prioritizes their basic rights as human beings over whether they generate profit for a large corporation.
I think we all agree on that end goal, but we just see different ways to get there. I believe that by strategically using the tools available to us, including technology, we can make significant positive change, even within the existing system. Then we can work on more fundamental systemic issues over time. We need to meet the people where they are at and provide them with options. I think the idea that we can completely revamp the system overnight is naive. There are financial, political, and technological realities to consider.
Yeah, I think that's a very realistic position. It's a long game, and we have to be pragmatic, even if some of our long-term goals might be aligned. It's about finding solutions that work within the parameters we have and not expecting to build utopia overnight. It's about responsible innovation and regulation so that everyone benefits and we don't just end up further marginalizing people.
But if we are always playing by the existing system's rules, then how will we ever change the fundamental problem? Incremental change has been the go-to solution for decades, and where has it gotten us? It feels like we're rearranging the deck chairs on the Titanic. We have to be willing to challenge the status quo and advocate for a system that actually puts health before wealth. The current system is a Titanic, and we are all on it.
And I understand the frustration with incremental change and its history of failure. But again, I think it's about leveraging what we have and trying to change things from within, while pushing for the big picture change. And technology, these AI tools, that's how it starts. It's the foundation for a new world where profit is not the only driver. It may not be fast enough for some, but it's what is possible right now.
I think there's a balance. We need to acknowledge the realities of the current situation while also pushing for meaningful reform. We need to recognize that there are some things that we just aren't able to change overnight. But at the same time, we need to also advocate for government involvement, regulation, oversight, and we need to do it all responsibly, without tearing down what we already have built up and that functions reasonably well for most people.
So then what's our call to action? How do we take this conversation beyond the theoretical and get closer to a reality where people matter more than profit? Because, as we are seeing from the fires and everything else happening around the world, our current direction is not working.
I think it starts with supporting innovation that promotes equity. It means being vocal about the need for ethical development and deployment of technology in healthcare. We need to hold companies accountable, support policies that promote transparency, and demand that AI systems serve the public good, not just the bottom line of corporations. And in the case of the LA fires, helping people who are displaced and supporting them through the immediate impact. There is a need for immediate and lasting change.
And it means engaging in the political process. It means supporting policies that address systemic inequalities, that expand access to care, and that regulate industries that put profit ahead of people. It's a combination of top-down and bottom-up approach. It also means advocating for community-level support during natural disasters such as these fires, as well as promoting the science and research that can improve our technologies.
And it means, more than anything, keeping the focus on people. Remembering that behind every statistic, every data point, there is a human being with a story, and those stories need to be at the heart of any changes we make. I think we need to talk about how we value human life and make that core to our framework. It can't be about profit. It has to be about people.
Yes, I think that's the key, keeping those stories in mind as we navigate this complex landscape and ensuring we do not forget the people who are most affected. And sometimes people will get caught in between the big changes we are seeing. And in cases like that, we need to help them.
Absolutely. We need to remember that these are not just abstract problems. They are real. They are impacting people's lives. And we need to keep working on practical solutions that help people now while pushing for broader long-term change. We can't lose track of the human element. It is often easy to get lost in the debate and forget the real people who are impacted by our decisions.
Well, thank you both for the conversation. It's clear we have a lot of work to do. But by having these discussions, we get closer to understanding the complexities of the system. And hopefully, we can move forward together towards a more just and equitable healthcare system and a better world.
Agreed. These discussions are important, and I hope that our listeners can take some of this and apply it to their day-to-day lives. We need more of these conversations.
Yes, and it is through these conversations that we can learn and grow. Thank you both for the discussion, and I hope to have another one soon.